guys, welcome back to my YouTube channel. Hope you guys are well. This is me, Amna. I am registered pharmacist. Today we are going to talk about DHA, HAAD, SLE, MOH exam past paper. This is our first lesson on this subject. We are not just covered MCQs but also discuss the reason behind the correct answer. These are the most important MCQs for Arab countries exam for pharmacy license. So we are not going to waste our time, precious time. Let's move on the question paper. Question number 1. Which one of the following estrogen taken orally? On option A, estrogen, option B, estrogen gluconate, option C, estrogen malate, all of the above. So the correct answer is option B, estrogen gluconate. Estrogen is a hormone that can be taken orally as a medication for various medical conditions related to the hormonal imbalance such as menopausal symptoms, osteoporosis, and certain type of cancer. Estrogen tablets are available in various forms and doses, including conjugated estrogen, esterified estrogen, and micronized estradiol. Estrogen gluconate acid is used for estrogen replacement therapy. On the other hand, estrogen malate is not commonly used for estrogen for oral administration. Malic acid is a type of organic acid used as a food additive and a flavoring agent, and it is not typically used as a carrier or a salt for estrogen medication. Therefore, the correct answer is estrogen gluconate. Question number 2. The responsibility of a pharmacist in hospital is to deal with administration of drug. B. Deal with patient. C. Deal with drug interaction. D. Notice effect of drug. As a pharmacist in hospital setting are responsible for monitoring drug interaction and contraindication to ensure that patients are receiving safe and effective medication. So the correct answer is deal with drug interaction. Question number 3. Plasma concentration of drug in body. A. Rate of absorption depends on rate of absorption, rate of distribution, rate of binding, and therapeutic volume. So the correct answer is the rate of absorption can also affect the plasma concentration of a drug in the body, as it determines how quickly and efficiently the drug enters the bloodstream after administration. When a drug is administered, its absorption rate can be affected by various factors such as the route of administration, the formulation of the drug, the presence of food or other substances in the stomach or intestine. The rate of absorption can also vary between individuals based on their age, sex, health status, and other factors. So the correct answer is rate of absorption. Question number 4. The following statements are wrong about domperidone except antiemetic without CNS effect, anticoagulant, antiemetic with severe CNS effect, or none of the above. So the correct statement about domperidone is antiemetic without CNS effect. Domperidone is a medication used to treat nausea, vomiting. It works by blocking dopamine receptor in the digestive system, which help to prevent nausea, vomiting. Unlike some other antiemetic medication, domperidone doesn't cross the blood-brain barrier and therefore does not have significant central nervous system effect. Option B, anticoagulant. Option C, antiemetic, and CNS effect are incorrect because domperidone is not an anticoagulant and doesn't have any CNS side effect. It is important to note that domperidone has been associated with a small increase in risk of serious cardiac side effect, and it is not approved for use in mostly in countries. So question number 5. You should keep the prescription of narcotic in the pharmacy for 2 years, 3 years, 4 years, 5 years. So the length of time that pharmacies are required to keep prescription record for controlled substances such as narcotic can vary depending on the country and jurisdiction. In the United States, for example, pharmacies are generally required to keep record for controlled substances prescription of a minimum 2 years, but some other may have longer detention. Like in Pakistan, it's up to about 2 years, but in DHA, SLE, and Dubai, it's about 5 years. So the correct answer, because we are preparing DHA, SLE exam, so the correct answer is 5 years. It's obviously depend on the country. Question number 6. pK of normal water at room temperature is 7, 14, 10 by 7, 10 square 14, 10 square minus 14. Yes, you are correct. The pK of water at room temperature is not defined as water is not acid. The correct option for the given question is 40B, 14. Why? The pK value is generally used to describe the acidity or basicity of weak acid and base. Water is a natural substance, does not have an associated pK value. However, the dissociation constant of water, like Kw, can be used to calculate the concentration of H plus and OH minus ion in aqueous solution. At temperature, the Kw value of water is approximately 1 multiplied by 10 minus 14. The product of the concentration H plus ions, the concentration of OH minus ion, what is always equal to the values. Therefore, the concentration of H plus ion and the concentration of OH minus ion is pure water are equal, and each is approximately 1 multiplied by 10 minus 7, and taking the negative value logarithm of Kw give the pKw, which is equal to 14. This means the pK of water is equal to 7, pKw is equal to Therefore, the correct answer of the given question is B. Question number 7 is about syncope may occur at first dose of choline, digoxin, salbutamol, prazosin, risperidone, or clonidine. Prazosin is an alpha blocker medication used to treat high blood pressure and benign prostatic hyperplasia. It can cause decrease in blood pressure, which may lead to syncope or fainting, especially at the first dose with sudden increase in dosage. Digoxin, on the other hand, is a medication used to treat heart failure, certain heart rhythm disorder. While it can be side effects, dizziness, nausea, and headache, syncope is not typically associated with digoxin, and so on with risperidone, clinidone. So the correct answer is prazosin. So, question number 8, which one is more effective against traveler's diarrhea? Quinolones have been the drug of choice. Answer A, amoxicillin, ciprofloxacin, sulfamethoxazole, or erythromycin. The correct answer is ciprofloxacin. More effective drug against traveler diarrhea. B is ciprofloxacin, which belongs to the quinolones of antibiotics, which has been drug of choice. Quinolones, including ciprofloxacin, are broad-spectrum antibiotics that are effective against a wide range of bacterial infection, including those that cause traveler's diarrhea. They are preferred over other antibiotics for traveler's diarrhea because they are well tolerated and effective against a broad range of bacterial pathogens that cause the condition. While amoxicillin and erythromycin are also antibiotics that can be used to treat traveler diarrhea, but they are not as effective as ciprofloxacin. Sulfamethoxazole is not a quinolone antibiotic and it's not typically prescribed to treat traveler's diarrhea. So correct answer is B. Let's move on to question number 9. Antihypertensive produce tachycardia. Which antihypertensive drug produce tachycardia? Hydralazine, rezapine, methyl-dopa, atenolol, clonidine. So the correct answer is hydralazine. It's a direct-acting vasodilator that relaxes the smooth muscles in blood vessels, leading to decrease in blood pressure. However, hydralazine can also cause reflex tachycardia, which is an increased heart attack that occurs as compensatory response to the decrease in blood pressure. Rezapine, methyl-dopa, atenolol, or clonidine, on the other hand, are antihypertensive medication that are not typically cause tachycardia as a side effect. So the correct answer is A. Today's last question. The action of digoxin can be reduced with antacids, verapamil, hypokalemia, hypothyroidism, hyperthyroidism. Yes, you are correct. The action of digoxin can be affected by hyperthyroidism, which is a condition characterized by an overactive thyroid gland, elevate level of thyroid hormone in the blood. High level of thyroid hormone can increase the sensitivity to the heart of digoxin, leading to an increased risk of toxicity. Therefore, the correct answer is hyperthyroidism. Thank you. Please do comment if you have any query regarding this question and answer, and please do like and subscribe to get notification for the second lecture. Thank you.